So I think there's a lot of new things going on in EGFR mutation-positive lung cancer, and it's been a pretty exciting meeting. I think one of the most interesting things I saw was Tony Mock's update on the IMPRESS study. This was a randomized study. It's recently been published, the overall results, where patients got frontline gefitinib, and then at the time of progression, they were randomized to continue the gefitinib with chemo or to stop the gefitinib, take placebo with chemo. And I think the IMPRESS results surprised a lot of people. They surprised me because I sort of assumed that continuing the gefitinib with chemo would be better, but that's not what the results showed. There was no difference, no benefit to doing that. Well, this meeting, Tony presented an update of looking at the genotype of patients when they progress, and he found that the patients who did have a T790M resistance mutation, they didn't seem to benefit from continuing the gefitinib, but patients who lacked the resistance mutation did seem to benefit and had an improved progression-free survival when gefitinib was continued with chemo rather than chemo alone. And this kind of makes sense if you think about it, because T790M is a resistance mechanism to gefitinib, so maybe if you have that, the gefitinib doesn't add as much. But I think this gives patients a nice option, because if they don't have T790M, maybe they would benefit further from ongoing TKI, whichever TKI they're on.